Chris and I are lucky to present our PACER internship project, which was called the Hidden Pathways of Chronic Illness. We had fun reminiscing over this project. It was a lot of fun working on this project. I personally, probably Chris too, would love to do a little more work around this. It was a great experience for us, I think. I mean, I don't mean to speak for Chris, but I certainly had a great experience working on this project. And we'll start off with providing a little bit of background information around the patient and community engagement research program out of the University of Calgary. I'm not sure if we've done any PACER presented any PACER projects at the Journal Club yet. Okay, so this is the first one. So that's exciting as well, because this is a very different sort of approach, I guess. It's a bit of a novel approach to research. So let's get right into it. So let's talk a little bit about PACER, and I'm just going to describe it kind of in a nutshell. So PACER is basically a patient-led peer-to-peer type research. It's a specific methodology that was developed by Dr. Nancy Marlette, as well as the PACER program. She's the founder and director of Patient and Community Engagement Research. And so it's really patients leading the research together with peers, other patients throughout the research cycle. So from uptake, writing the proposal, deciding on the question, and then all the way through to the end of writing a report. And we're going to talk a little bit about the PACER methodology, because it'll help to set the stage and give a little bit of background information as we move forward into the presentation, and you'll get to sort of see how this project rolled out. So in the PACER methodology, we as a team, as the research team, so all sort of patient and community engagement researchers get together and start discussing topics of interest and sort of loose research questions. And then we take that into what's called a set focus group. And that's where we work together with other patients to really sort of hone in on that research question and then the direction of the research as we move forward. From there, we go into the collect phase, which is basically the data collection. So whether it could be focus groups, interviews, and so we decide on that. And the set focus group also helps to sort of steer that direction into, so what do we need to do next? Are we conducting focus groups? Are we going to be conducting narrative interviews, etc.? So once we collect the data and we have a chance to do sort of a preliminary analysis, then we go into the reflect focus group, which is circling back with individuals that attended the set focus group to sort of validate and go over some of the findings and make sure, again, that we're on the right track. And then we look into the implementation piece. So this is just a picture of our 2013/14 PACER class. So we had two cohorts in our whole class. One cohort that worked on a wellspring, so a cancer research project, and then our cohort who worked on the hidden pathways of chronic illness. So let's talk a little bit more now about our project, the Hidden Pathways of Chronic Illness. So our research question, again, so after working together with the set focus group, we came to a question that basically was, how do patients make sense of living through chronic illness? And so this came about with the realization that I think we're very much socialized from healthcare to easily talk about our clinical pathways. So, you know, yeah, I was in for an MRI, went for blood work. Those things are very easy to talk about with the healthcare professionals, but also people around you. It seems sort of easier to bring those things up. But the day-to-day living with chronic disease and the hard stuff that people struggle and challenge with are harder things to really be open and talk about those things, because there's just a lot of, I want to use a swear word right now, but I'm not going to, but there's a lot of not fun things that we go through and not easy to share. And So we kind of became aware that, you know, even when we're talking to healthcare providers, you know, sometimes we sugarcoat things, or sort of we read people like, oh, it doesn't look like they're receiving this information well, and then we sort of back off. And, you know, some of those types of dynamics that happen when you live with chronic disease. So that was sort of the reason behind this project, is like, what do people actually live with the other 364 days a year that they're not seeing their healthcare provider, or, you know, doing sort of the clinical aspect of managing their disease. So a little bit of background in the sample and data collection. We had 22 participants that joined our group, and from age ranges of 50 to 81 with one or more chronic diseases. And you see the list on the slide. We have people with a variety of chronic diseases that joined and helped us out with this study. And then we started off with one set focus group. We did 2 collect focus groups using creative expression mind maps, and we'll talk a little bit about that in a moment. We did 7 narrative interviews with the purpose to get sort of to provide an opportunity really to dig in deeper and have people share their full stories and experiences around living with chronic disease. And then our last reflect focus group, where we circled back with the set focus group participants. So this is just some images from the mind maps. And so these happened, we did a trial run in the set focus group to sort of see how this went. Well, actually back up, we actually did a trial run with our team and the other team that were a part of the PACER cohort who were taking the class, just to sort of test that out. And everyone sort of liked that concept. And then we brought it into the set focus group to see how that went sort of once we hit the ground running. And it was integral to this work. We knew going in that we were going to be touching on very sensitive and hard to talk about subjects. And so we wanted to create an opportunity for people to reflect on their experiences prior to even talking about some of the aspects that they've been through and challenges and struggles of living with chronic disease. So at the very beginning of each focus group, we set aside approximately half an hour. We played just some relaxing music. We gave everyone large sort of flip chart size papers, threw crayons and markers on the table, and then sort of laid out, you know, the idea around mind mapping, and then gave everyone that opportunity to just sit and think about some of their experiences of living with chronic illness and what that looks like, and then putting it to paper. And so what happened with that was that it provided that time for people to think about some of the things they've been through. And there's a process of getting it to the paper and then realizing some of the things that would stand out for them. So once we finished that process, we basically just, you know, it was up to every person in the room, whether they're comfortable or not. So they didn't have to share, but so we opened it up to the room and said, would anyone be comfortable and willing to share their mind map and, you know, some of the key discoveries that has come out of that process. And it was amazing. So the very first person was like, I'll share. She stood up, she held the mind map in front of her and, you know, sort of explained, like, I didn't realize I was holding so much fear and all these different things that came up from it. And then it just followed around the table. And very quickly people started connecting because they're listening to other people and their struggles. And it was actually really interesting. It was like the name of the disease, so whatever people were living with, just faded to the background, and people were relating with one another with the common struggles that they dealt with sort of day to day of living with chronic disease. There was no sort of competition of like, well, I have, you know, diabetes, which is worse than what you're living with. None of that kind of stuff happened. It was really all about the human struggle of living with chronic disease. And we had one, just as a little story, we had one of our focus group participants had not been out socially for 10 years. She was very highly anxious in joining the group. We worked with her, so we did pre-engagement prior to the focus group. We really made it as safe space as possible for everyone to join, but also basically, you know, you're the driver of the car. Whatever you're comfortable sharing is fine. You can sit and listen, that's fine too. Whatever, you know, whatever, that it's up to you basically. And in the end, I think after, you know, her being there and being present and listening to other people, it gave her that chance to connect and hear from others and realize like these people get it. And then she just, you know, started talking, and I think it was the first time she really got to share a lot of the struggles that she's dealt with over the years with her chronic disease. So it was really interesting dynamic. It was really actually quite an honor to be and a privilege to be like in those focus groups, and having people, virtually strangers, share some of their, you know, very kind of I don't want to say secret, but I mean, there certainly was a few people who had never shared certain experiences until they came to this focus group. So it was a very interesting dynamic. So we're going to go into some of the findings that came from our work. And so, and Chris will go into more details of each area, just sort of provide a bit of an overview of each area of the findings. And so we kind of came up with, again, together with some of the patients who we worked with, metaphors that went with each stage of living with chronic disease. These are individual, they're not linear where you move up the ladder and then you're good to go and everything's fine. It's more, and you'll see a graphic we have later on, you can swing back and forth through those areas. You can go into lows, or, you know, swing into a low, but maybe not quite as low as other times. And you'll understand what I'm saying a little bit better shortly. So the 6 key findings that came from this, and these are 6 potential pathways that we've uncovered. Whether we have uncovered all of them is another question, or if there's disease specific or different age group is another question. But so we have finding yourself in an alien land. I'm not going to go through these because Chris will in a moment. Searching for answers as a way out, finding you are on your own, searching for meaning, presenting your new self, and understanding you are your own boss. So these were sort of the metaphors. And if you had an opportunity to read the paper, we go through sort of the description of those metaphors in the paper. And so Chris, I'll pass the baton over to you, and just let me know when you want me to forward the slides.
Great, thank you very much. So the alien land is sort of a term we came up with to capture the sentiments. And as Sandra mentioned, it was sort of interesting because people would arrive with, you know, 15 or 20 different chronic conditions, but guess what? They all landed in the same spot. So you're going on vacation and you can go anywhere in the world. And guess what? You all end up at the alien land. So what is the alien land? It's perhaps best described by one of our rancher researchers, lives in southern Alberta, has a big ranch, big spread, and she described it as, so you're coming home from vacation and you come down the road and everything has been blasted. It looks like a nuclear bomb has gone off. All your trees have lost their foliage. There's nothing left of a barn except some charred foundation and perhaps a bit of a chimney. So this is sort of the landscape that many people diagnosed with a chronic disease find themselves in. They were good one day, and then the next day they're in this alien land, and they just don't know what happened. They're just beside themselves. And the quote there is that the future looks bleak and the situation impossible to understand. So that's why on that graphic we'll show you at the end, this is sort of the beginning of the journey. And Sandra and I call it the skateboard chart, because you see them starting here and they all of a sudden do a deep dive and then they make it back. But it's quite a journey. So you go from being totally normal to being totally upside down. So you ask yourself, where am I? What happened? Why am I here? So some of the normal outcomes, and many of you with chronic disease will have gone through this. You have ongoing pain. This is something you didn't have before. Perhaps it morphs into a depression. Loneliness was a common factor. One lady commented her arthritis was not as painful as her depression. So here she had a chronic disease, debilitating arthritis. It rendered her, virtually unmovable. And that wasn't as bad as the depression that she felt, which was a symptom of her chronic disease. So it's sort of interesting. So human beings are terrifically resourceful. So the rest of the slides will kind of outline how people get out of this situation. The middle comment there is really germane too, because a lot of people felt terrific anger. One of the participants said, well, I did everything I was supposed to do. I didn't eat fatty foods. I didn't smoke. I didn't do drugs. I tried to get a lot of sleep. I kicked my lousy husband out of the house, and I still got cancer. So what happened? How did that happen? It doesn't seem fair. So anyway, eventually they said, anger would grasp me and I could easily get stuck in my box. So what we found in this journey was that it's the process of unsticking themselves, getting out of that box, that provided people with terrific relief. The other common presenting issue was fear. And the fear of the unknown is often more devastating than fear of the known. And people just did not know. So one individual, I think it morphed into a level of panic. So here it started out as, okay, you're diagnosed with cancer and here are the modalities and here's the treatment and here's how it'll go. But inside, this level of panic just kept rising and rising within her. So her defense was to kind of move inward to try and control it so that it wouldn't overcome her. The other interesting finding, and this is an area for further study that Sandra and I talked about, is the whole process of what the group was going through was almost a form of treatment for them. It was a form of catharsis. So the focus groups provided an outlet for individuals. They were stuck in their boxes. This lady hadn't gone, I call her Rose, this lady that Sandra commented on earlier, hadn't been out for 10 years. And we asked them to draw their lives. Well, initially, her body language was like this. Niet, forget it. I'm not doing it. Niet, niet, niet. So there she was. I guess we gave them 20 minutes. Probably, she didn't move from that position for about 10 minutes. Then around the 11-minute mark, she picked up her crayon and sort of went like that. And, oh, what's she going to do? I didn't watch her exclusively. But what emerged was this beautiful rose, fantastic rose. And as Sandra mentioned, everybody else spoke for 5 minutes. She hadn't been out of the house for 10 years. She spoke for, I think it was 10 or 15 minutes. She spoke 4 times as much as anybody else. So that's an indication of how therapy, and really our sessions were a form of therapy, enabled her to get out of her box. What else was it? Oh yeah, our focus groups provided an outlet for individuals to come forward, like that lady who had been out in 10 years. So one of them said, she no longer has to live in silence because you're fearful. Your disease has presented an upside down world, and you're just fearful of sharing it with others, sharing it with your family knows, but I mean, your friends, I don't know, am I going to lose my friends if I share it? What about my employer? What are they going to say? What about people you meet in the grocery store? How are you today? Well, guess what? Am I going to tell them the truth? Next slide, please. So the initial reaction is, well, you know, here I am in the alien land. What's the way out? I don't really want to be in this. I wanted a nice vacation. I didn't want to end up here. So searching for answers and solutions. Many did approach it like anybody else, on a shopping expedition and like a problem-solving expedition. Many of these individuals we had in our group were kind of individuals that were used to solving problems. So along comes a giant problem. So, well, we can just deal with that. This is just another problem in our way. We'll figure it out. So they approached life kind of as an information supermarket, going online, Doctor Google, try to find some answers, researching the problem, and finding their own way of dealing with the situation. One of our participants there, I think it was Cyrene, my long days in hospital spent trying to understand the beast that was in front of us. I was convinced that if we educated ourselves or by our opponent, we would outsmart him. So the feeling there was that most things can be solved through education and knowledge, and this is just another one. Turned out it didn't quite work out as well as they expected, but anyway, that was part of their solution. One of them found, instead of pills, that heat, meditation, massage, and acupuncture provided just as effective pain relief. So the kind of the message there was, fears are dispelled by education. So many of our group kind of became experts in whatever disease they were facing. That was their methodology to find a way out. Next slide, please. So the other finding was that most people realized they were on their own. It's up to me. I have to craft this new journey that I'm on. No one else is going to do it for me. I mean, you go to the doctor and they prescribe medications and treatments and plans, and they outline the clinical pathway, which is relatively well trodden. But the individual psychological pathway, the qualitative journey, which relates to how you deal with it, how you get through the day, how you deal with friends and family, that's all completely uncharted. And they don't teach you that in the clinic that you're going to. They leave that's up to you. That's your own homework. But many of the people found that they had to be their own counselor and take it completely into their own hands. One of the participants found that her husband was actually, and this is kind of a little unusual in this group, I suppose, especially, that her husband was doing too much for her. So here she was struggling to be independent, and her husband was doing everything. Well, in fact, he was enabling her to lose more control. So eventually she told him to just back off and be available for when I ask. And the other great finding was that people had to learn how to ask, because here they were independent their entire lives, and now they can't do simple things. So they had to learn how to ask people. And others spoke of developing new friends, losing old friends, and having developed new friends that perhaps had more empathy or understood them better. One of the participants had to take decisive action. I think that's the one where she had, I think it was leukemia, and one of the medications prescribed was given, I think it was weekly by her husband, and she turned completely yellow. Well, it turned out her husband was trying to kill her. He was over-medicating her. So I guess the husband had a mistress on the side. Anyway, she took decisive action. She moved from, I think it was Quebec, moved to Alberta, where her daughter was a nurse, and recrafted a new life. And the amazing conclusion to that story was she presented in Alberta, and they did an MRI, and they found that she was completely disease-free. So a remarkable outcome. where just removing the stress situation, her life in Quebec where her husband was cheating, led to a complete elimination or perhaps containment of the disease. I'm not sure what happened later, but that gives you an idea of how people craft their lives in extreme ways to suit their situation. Next slide, please. So, okay, so you've kind of developed a way of dealing with the day-to-day principles of your disease and establishing some new ways of getting along. And then you kind of wonder, well, what is the personal meaning? What is the value? What are my new priorities? So one of the outcomes for many of the people was that helping others helped them get out of their shells. Volunteering, perhaps for the first time in their lives, became a real motivating factor for them. For others, it was faith and meditation that helped them heal. Others found creative expression as a way to give them meaning in their lives. Many people became journalers or artists, or the one lady who had difficulties from abuse as a child, I think became a gardener. So she completely changed her life and created gardens for others that helped her heal along the way. There was, I think, one of the ladies was a motorcycle aficionado and leather jackets and the whole bit. And so I think we were talking about what people do to relax and solve some of their pain problems. And I think one of the questions was, well, do you use medications? And she said, hell no. If I want relief, I just get on my sickle and I ride. So that was a great moment. I still remember it to this day. Next slide, please. Presenting a new self, and this one I think in the article, if you read it, the poster child there is Sandra, who's talked about how you kind of have to reframe your existence and see yourself through other people's eyes, and reframe what you're doing, so that you make yourself, I guess, friendly and approachable to other people, because they're not used to dealing with your disease. They're not used to dealing with people who are coming from an alien land. So you have to kind of educate them about what you're going through. And maybe Sandra can explain a little more later, but she had to craft 3 personas for herself. One was for her medical community whenever she went to the clinic and so on. The other was for her family and friends. And the third one was for employers. Because obviously if you're going for a job interview and you happen to let slip that you're on chemo, or you've got tremendous backache or osteoarthritis or whatever, chances are they will pass you over for someone else. And so it's often very useful to create these alternate personas. You're not actually deceiving anyone, because it's illegal to ask questions around medical history in an interview, but you're just not volunteering stuff that would obviously kick you out of the employment situation. So that was sort of an interesting finding. One person found that their disease was sort of okay. She could handle that, but what she couldn't handle was how other people dealt with her disease. So she had to go to counseling to get advice on how she can reframe herself, so that once again she could relate to people in the non-chronic disease world, if you like. So that was sort of an interesting finding. And the last comment there: learning to be a chameleon. You may have to learn not to speak about your illness with some and hide it from others. So the answer to the "How are you today?" question is always, "Oh, just great, feeling fine, thank you." Whereas if someone else comes up to you who you know has had a chronic disease, and you know you can speak comfortably with them, well, you can get into the latest rounds of chemo and what you've done to mitigate their outcomes and all the rest of it in great detail. It'll probably take you 10 minutes to explain that simple answer. So these were common findings across all the disease states. Next slide, please. So not the boss of me, shared leadership of your healthcare with your team. So this was kind of a key finding for the most successful participants in our group. Those that created their own treatment teams, that created their own friends, created their own allies, did considerably better than those who were loners. The person who's stuck in their room for 10 years obviously didn't do any of that, so obviously would not be anywhere close as being successful in mitigating the outcomes, and someone who grabbed it right away and developed their own team and their own resources and helped to craft a more successful outcome. The other thing that I always like to mention to groups is those that reframed their lives in that discussion also proved themselves more successful. What I mean by that is, if before your disease your fitness level or your quality of life level was, say, a 8 out of 10, after your disease it'll never get back to 8 out of 10. So maybe you're at a 4 out of 10 or a 5 out of 10. So don't pretend you're going to get back to that 8 ever. Just set 4 or 5 as your target for life. And maybe a really bad day you're at a 1 or a 2. But when you get up to a 4 or 5, you give yourself a high five, because guess what? You're doing as well as you possibly can under that situation. And once people realize that, they say, hey, this isn't that bad. And I like the thing there about taking charge, telling healthcare providers, this is tough to do. I forget who the participant was, but doctors, we know our own bodies better than you, docs, sitting there, other side of the table. Listen to what I have to say, because I'm listening to my body and what I need. So, I mean, those are really hard words to put across to your medical practitioners. But yeah, those were some of the things that we ran into. Next slide, please. So there's the skateboard park that we came up with, and you can see it starts on the left with the alien land, and then it plummets quickly into searching for answers. And then you're on your own, and you're developing your team together, searching for meaning. You're presenting yourself, a new self, and you're learning how to be your own boss. And you notice you didn't get back to the 10 out of 10 you had before, but you're up at a 6, 7, or 8 level out of 10, and you're doing pretty well, the best that could be done under the circumstances. So that was really the beauty of this research study. And it was only, I guess, when we were getting into it that this sort of popped out. And that's the other beauty of patient-led research. You sort of know where you're going, but you're really not sure what you'll find, because it's such a unique decision finding process that it's just a wonderful strategy. And the other thing I always like to mention is this was used for chronic disease, but you can use this same process for any particular issue that you're interested in researching. Any particular disease, any particular medical issue that comes along, if you use the same process and techniques, you will find very rich qualitative data that probably hasn't been explored earlier. So yeah, I'll turn that back to Sandra then.
Yeah, so just in conclusion, I mean, we sort of one little question framed. How do you see the patient experience as a way of informing and changing healthcare? And then basically as a summary, we've uncovered 6 possible pathways that patients experience when living with chronic disease, potentially untapped area for further research. And the patient and community engagement research is a simple and universal method that can be applied, so as Chris was just alluding to any patient experiences and outcome analysis in multiple health areas. And the PACER program, you know, is still alive and well, and we have a few. Karen and Linda, I know, are in the room, so they're currently taking the course, and so we've had a lot of PACER research done since we've done it. So I'll just stop there. Thanks for sort of listening to our recap of the study, and then